athletic trainer here at San Houston State. What's going on? What is your name?
Bobby.
All right, Bobby. Tell me what's going on.
So when I play basketball, I just feel this tightness and this out of breath, and it feels like it takes me a long time to catch my breath. I don't know. It's been happening this past year, so I've never really dealt with anything like this. It really started hurting this year.
Okay. So it's been going on for the past year?
Yeah. Once I got into college, really.
Okay.
Yeah.
Okay.
This is my first year.
Okay, this is your first year?
Mm-hmm.
All right. And then you play basketball, is that correct?
Yeah, I do.
Okay, how old are you?
18.
Alright. So is it only feeling that tightness and not being able to catch your breath happening like during practice, or does it happen throughout the day?
Yeah, I guess. There's a lot of hills on campus, so I guess catching my breath, it's like an all-day kind of thing.
Okay.
I don't know, like whenever I do any physical activity.
Okay. So what makes it feel better? Once you're having all these symptoms, like, how do you get to calm it down?
Just doing this, really. Laying down, doing nothing.
Okay. So resting makes it feel better?
Mm-hmm.
Alright. So whenever you're having these symptoms, does it radiate to your arm, down to your legs, maybe to your back or your head?
Yeah, I guess my back and I could feel it kind of like in my left shoulder, and sometimes it goes down my arm, but normally it stops pretty soon.
Which shoulder?
My left one.
Alright. So with this going on, how are you been able to practice?
Only a couple minutes at a time.
Okay.
Like, I don't know, it's hard for me to catch my breath. That's the only thing. Like, I started doing good, and then, I don't know, it's just decreasing my playing time.
Okay. So are you having to sit down a lot more now?
Yeah, I'm gonna have to, like, it's just hard for me to catch my breath standing up.
Okay. So I would imagine that it gets worse whenever you're running, huh?
Yeah, it gets really bad with physical activity.
Okay. Alright. So I'm gonna ask you a few questions about your family history, is that okay?
Yeah, for sure.
Alright. So, in your family, have you had any member pass away due to or having heart attack by the age of 50 or even below age 50?
Yeah, my dad.
Okay.
My dad passed away from a heart attack, and that was just a couple years ago. I think he was like 47, 46. It was a tough time during my life.
Alright. Does high blood pressure run in your family?
Yeah, high blood pressure. My uncle has high blood pressure on my mom's side, and my dad's. Yeah, like my aunt has diabetes, I think. I'm not really sure, but I think those three for sure have something wrong with them.
Okay. Have you ever had any heart problems whenever you've gone to the doctors? Have you been
No, not really. I've been pretty good, I think. I passed all my physicals.
Okay.
Mm-hmm.
Alright. Thank you for sharing about your family history. So I'm gonna ask you a few more questions. Is that okay?
Yeah.
Alright. Do you drink or smoke?
Well, I used to smoke in high school. I just thought it was the cool thing to do, and then I got away from it. I mean, alcohol I would drink very rarely. I like to let loose once school's been stressful. I miss my dad. Yeah, that's about it. Other than that, no.
Okay. How much did you used to smoke?
It was like very rarely. It was probably 1 to 2 cigarettes, maybe every couple months. Honestly, I would say one every 2 months. It was just an occasional thing.
Okay. Alright. Let's see. So you say you passed all your physicals. So you've never been diagnosed with any heart disease or anything like that, correct?
No, I just have asthma. That's the only thing I have. It's hard for me to breathe, so I've just been thinking it's my asthma.
Okay. Do you know if you have any high blood pressure?
No.
Okay.
I've never experienced it. I've been stressed out lately, so who knows?
Alright. And then you're not having any swelling on your legs or any tingling on your legs, anything like that?
No.
Okay. It's just on your chest, sometimes going down your left arm or shoulder?
Yeah, just my chest and my left arm.
Alright. So this is what we're gonna do. I'm gonna take your vital signs right now. Okay. And then I'm going to listen to your heart and lungs. Is that okay?
Yeah, that's perfect.
Alright, so let me go wash up. Washing. I'm taking vital signs.
Okay.
Ooh, we didn't bring them.
It's alright. I'll just tell you.
Okay, blood pressure?
130 over 92.
130 over 92?
Yeah.
Okay. Pulse?
86.
Pulse oximeter?
97.
Respirations?
14.
Temperature?
98.9.
Okay. Alright, Bobby. I'm going to listen to your heart, okay?
Okay.
Alright. Alright, take a deep breath in. Another deep breath in. Okay. And another deep breath in. Alright. Alright. Okay, Bobby. I'm gonna ask you to sit up. He sits up. I listen to his lung sounds on his back. Do I hear anything?
No. You hear a little bit of wheezing, but that's due to asthma.
Okay. With the heart, do I hear any whooshing, any murmurs?
No.
Okay. Alright. So, Bobby, I'm going to palpate your lip nodes that are in your jaw area. Is that okay with you?
Yeah, that's good.
Alright. So, palpating lip nodes. No pain there?
No pain.
Okay. Checking carotid pulse. Alright, that sounds good. Alright. And then checking his left shoulder.
Mm-hmm.
No pain there.
No pain.
Okay. Alright. Radial pulse. Is it
Compared to the carotid, it's decreased.
decreased?
Mm-hmm.
Okay. Capillary refill?
Normal.
Normal?
Actually, slower compared bilateral.
Okay.
It's slow.
Okay. Alright, Bobby, so I'm gonna go ahead and check your legs. Have you traveled it recently or anything like that?
No, I haven't.
You have not?
Yeah, I mean, just bus rides to different schools.
Alright, how long have those bus rides been? Yeah.
Longest one's like 5 hours.
Okay. Palpating calves, checking for swelling, any pitting edema, checking posterior pulse.
Good.
Good. Dorsey.
Good.
Okay.
Normal on both sides, or both.
Okay. Comparing on the other side as well. Those are all good.
Yeah, both are good.
Alright. 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 So are you having any stomach pain or anything like that?
No stomach pain, just my chest.
And no nausea, anything?
Nuh-uh.
Alright. Have you been sick recently?
I haven't been.
Okay, that's good.
Yeah.
Alright. Have you ever seen a doctor before? Like a heart doctor? Cardiologist?
No, not really. I've never had a reason to.
Okay. Alright. So I'm gonna go ahead and just palpate your stomach, okay?
Yeah.
Just checking again. See if everything's okay. Alright. No pain there.
Mm-mm.
Okay, kidney.
No.
Alright. Diaphragm.
Good.
Okay. Spleen.
Mm-hmm. Good.
Okay. Descending.
Good.
Alright, and then stomach.
Good. Nothing.
Good. Loss on good.
Yeah.
And kidney.
Good.
Alright, Bobby. So this is what we're gonna do. I would like to do a EKG. Do you know what that is?
No.
Alright. So what an EKG is, it basically reads how your heart is palpating. So like the electrical rhythm of your heart. And it's just gonna tell me if everything is normal or if there's anything abnormal. If there is, then you are an adult, so you don't have to call your parents. But I would like to refer you to a myocardiologist or cardiologist. Excuse me. Okay.
Alrighty.
All right. So I do EKG, 12 lead.
Uh-huh.
What do I see?
I can show you the paper. Here is the EKG.
Okay. Alright. Thank you.
Oh, sorry.
Alright. Alright, Bobby. So is it pulse or normal or delayed, right?
Delayed.
So Bobby, we're gonna take a look at this. I would like you to go see a cardiologist. Keep saying that wrong. For further evaluation, okay? I want you to go there as soon as possible. Because within the family of having a history of heart problems, we're just gonna take a precaution, okay? It's not normal to just be getting super exhausting and having this constant chest pain. All right. And like I said, you are 18 years old, so you don't have to call your parents legally. But if it'll be good to touch your parents. Okay.
Yeah.
All right.
Okay.
Diagnosis, myocarditis, differential diagnosis would be the Wolf syndrome, and the what was the other one? Sickle cell.